Understanding the different types of lung cancer is crucial for accurate diagnosis and the development of personalized treatment plans, where early detection and advancements in treatment options contribute to improve outcomes for individuals with lung cancer.
Majorly, lung cancer are classified into two types. One is the non-small cell lung cancer, other one is the small cell lung cancer. Among the heading of non-small cell lung cancer, there are various cancers, among which the most common cancers are adenocarcinoma and squamous carcinoma. There is other subtypes like adenosquamous, large cell, sarcomatoid. So these are all the very less variant of the lung cancer. Among the cancer, non-small cell lung carcinoma constitute for almost about 80% of the cancers. Among the non-small cell lung cancers subtypes, adenocarcinoma is the most common, followed by that of the squamous cell carcinoma. Small cell lung carcinoma, which we traditionally call it as very aggressive, it constitutes somewhere around 15 to 20% of the whole lung cancer.
Well, lung cancer is a complex disease encompassing various types, each categorized by its unique features, and the symptoms of the same can manifest differently depending on the type and stage of the disease.
In non-small cell cancer, as I was telling you, there are two types. One is adeno, other one is the squamous. Squamous carcinoma usually most commonly seen in the smokers and the males. And usually the small cell, the squamous cell lung cancer lesions usually develop in the central part of the lung, usually in and around the mediastinum. So usually in the main bronchus. The main symptoms of the small squamous cell lung cancer in they come with cough. Sometimes they come to you with breathlessness. They may also come to you with hemoptysis.
Where the link between smoking and lung cancer is so strong that the majority of lung cancer cases are directly attributable to tobacco use. And no matter what type of cancer it is, the effect of smoking is always negative.
Smoking has more than 300 type of hazardous chemicals in that, among which around 60 are known to cause carcinoma. See, among these 60, the polycyclic hydrocarbons and nitrosamines are the most two common chemicals which are seen, which tend to cause cancers. So what they basically do is smoking causes the damage in the epithelium, thereby damaging the cells. So when the cells are damaged, these cells lose the capacity to undergo death. So for example, natural process in the body, the cells will undergo death on its own, which is called as apoptotic process. They won't die very easily, and also they proliferate very abnormally. So because of these chemicals and their intermediate products what is there in the smoke, the epithelium is stimulated and cells are stimulated, giving rise to proliferation.
The treatment approach for small cell lung cancer differs from that of non-small cell lung cancer due to the distinct characteristics, including its rapid growth.
Lung cancer treatment approach is different than other cancers, because in the literature there is say that if you diagnose a small cell lung cancer, you must initiate treatment as early as within 2 weeks. That means to say that small cell lung cancer is such an aggressive type of cancer, you need to start it very early. You can't take more time in the small cell lung cancer. One of the differences is that if you see the staging and all those things, small cell lung cancer, unlike other cancers, are broadly classified as limited staging and extensive staging. Limited staging is that it is limited to part of the radiotherapy which can be given, which is the curative intent. Extensive stage is that it has spread beyond the scope of radiation, whereby you have to give systemic therapy. A very few cancer patients in a small cell lung cancer, you can subject them for surgery.